So, my name is Achilleas Pavlou, and I'm a lecturer at the University of Nicosia in the medical school. And today I'm going to give an overview of the lucid dreaming research area. And I'm also going to take some time to present some of the results from my PhD studies, which was from my PhD, which was supervised by Dr. Nick Cooper and Dr. Elia Valentini at the University of Essex in the UK. So, what is lucid dreaming? So basically, lucid dreaming is the phenomenon whereby a dreamer becomes aware that they are dreaming while they're still dreaming. And this can range to like a passive, simple awareness that a person is dreaming, but also it can be even more, it can be more active in that the person not only knows that they're dreaming while they're dreaming, but they can also take, volitional control over the dream. They can influence the dream, perform certain the actions that they want, volitional actions, and make things appear, or basically take control of the dream, actively take control of the dream. So, in order to, there are questionnaires that may ask you, do you have a lucid dream, yes or no, and obviously, they give a definition of what is a lucid dream. But in order to, peer more into what constitutes a lucid dream, there's this, and quantifiably assess dream lucidity. The 8-factor lucid scale was developed by Voss and colleagues. And this lucid scale basically splits dream consciousness into 8 factors: insight, control, dissociation, realism, memory, thought, and positive and negative emotion. So to define these factors, insight is, it means is the knowledge that one is dreaming, that they understand that what is experienced is not real. The realism factor is defined as the sense of that there's a similarity between emotions, thoughts, and events that are experienced in the dream, and that they correspond to that of wakefulness. And control then is defined by the ability to influence the dream plot. And memory is defined as the ability to access waking memory. The thought factor describes the capability to think logically about the self and about other dream characters. And then obviously positive, negative emotion factor kind of looks into it rates how negative or positive are the emotions that are and the strength that they are experiencing in the dream. And then we have dissociation, which is sort of the ability to take a third person's perspective, almost to be disassociated from the dream character in a way. And using the lucid scale, there's a clear distinction between lucid and non-lucid dreams. So non-lucid dreams basically score low on most of these factors, especially on insight, control, and dissociation. And, like we said, the awareness can be passive or it can be active. So, this is kind of an example where, you're just passively watching the dream as if it's a movie in a way, but you know very well that what you're seeing is not real and that what you're experiencing is a dream. And it can be active where you decide to take certain actions or change things about the dream plot over here. So so how prevalent is lucid dreaming? It's it's thought to be a rare occurring phenomenon that happens during REM sleep, the stage of sleep that's most associated with dreaming. But how prevalent is it? So a recent meta-analysis by Saunders et al. In 2016 showed that about 55% have experienced at least one lucid dream in their life, and that 23% report experiencing lucid dreams once a month. And this kind of statistic, this kind of finding showcases that the capacity to lucid dream is widespread, actually. And I actually had a poll to share, but I think it won't be possible to see how many from our listeners here have experienced a lucid dream, but I would imagine, it would be more than 50% usually. So we know that, we have the phenomenological profile of lucid dreaming, but what is the neurobiological profile? So EEG and EEG and the fMRI EEG studies have shown basically that lucid dreams have like the similar REM-like delta and theta activity, but they have a higher than REM gamma activity peaking at 40 hertz in the frontal and frontotemporal regions of the brain. So this kind of activity, this activation of the frontal areas is thought to explain the increased consciousness that is exhibited and cognitive ability that's experienced by lucid dreamers. So, when people have normal dreams, basically, if you could think about most of the people, the dreams, we're more emotional, more impulsive. We usually have decreased critical thinking. We have minimal access to autobiographical memories. And obviously, we don't have insight into the fact that we're dreaming. And that is because when we're dreaming, when we're experiencing normal dreams, in the brain area that's associated with higher cognitive ability, the frontal areas are largely deactivated, but they light up, they start working and performing more closely. The brain activity starts resembling more that is experienced when we are awake. So we can see here where the difference between normal and lucid dreams is that this increase in activity in the frontal temporal regions leads to increased cognitive ability in dreams. And so during the 70s, it was theorized that lucid dreaming reflected brief waking periods in the night, but since then it has been debunked through the various psychophysiological measures that showcase that the person is asleep when they are experiencing lucid dreams. And we see that with, for example, brain activity resembles closely that of REM, more than wake, but it's slightly different. And also that there is complete muscle atonia when we're using, electromyography. But other than that, there are other psychophysiological measures that have been employed to validate that someone is lucid dreaming. So, for example, we can use eye movement. We know that eye movements during REM sleep, which is short for rapid eye movement sleep, correspond to where the dreamer is looking. So, in lucid dreaming research, we use these predetermined eye movement patterns that are set prior to sleeping, and we use them to signal dream lucidity to researchers, as well as signal the beginning and end of completed dream tasks. So, because as you know, our body is paralyzed and we have muscle atonia in REM sleep in order to not act out our dreams. And when this goes wrong, we have what's called sleep paralysis. But the only thing that we can actually move when we're sleeping and in REM sleep is our eyes. So using sensors close to the eyes, you see where if the person is looking left or if they're looking right, for example. Also, and we can ask them to do certain tasks. For example, you can ask them, look, left, right, in quick succession to signal that you're lucid dreaming, and then maybe use again a different eye movement pattern to do a specific task in the dream, such as run, for example, or do exercise. Or there's various examples, and these dream tasks again have been correlated with different types of sensors, such as heart rate and electromyography and many other sensors. So when we're talking about tasks as well, there is we've used this kind of different types of sensors to not only we can the dreamer can send back to the external world, basically speak to the external world using eye movement patterns for example, but also that there can also, it's not only just one way, but there's studies have shown that we can also have two-way communication between the lucid dreamers and the external world. So there's a couple of studies with that, but one of the studies that look, one of the latest one, just to look into real-time communication between the experimenter and the lucid dreamer was by Concoli et al. In 2021. And then basically this paper reports results from 4 independent scientific teams based in France, Germany, the Netherlands, and the USA, and they used different types of questions, for example, for example, they would ask them, what's, sorry. Okay, what is 1 + 2? And then they were, they decided before going to sleep that, okay, you need to, if you hear the mathematical equation, in order to answer, you have to look 3 times left in quick succession. So, and a lot of the times, about 47% lucid dreamers were able to hear the experimenter while still being asleep and respond to questions of mathematical equation solving, simple ones like what's 1 + 2 with their eyes. Also, they were able to respond to questions such as, do you watch football? And the way to say yes was to move their corrugator facial muscle, or use the zygomatic facial muscles to indicate yes or no. Obviously, when a person is asleep, there is muscle atonia, but if you dream strongly about a specific, conducting a specific muscle movement, sometimes you can get this kind of muscle twitches, which can then be captured by a sensor, an electromyogram sensor. So this would be, here for the corrugator would be a no, that they don't watch football. This is an example from the study. And moving on, I wanted to talk a little bit about, what makes someone more likely to lucid dream, and the frequency that they have, lucid dreams, and it varies from person to person. Some people, like we said, never had a lucid dream in their lives. Some have had maybe once in their life, maybe once a year, and there's a small amount of people who also, pretty much have lucid dreams every week, naturally, without doing anything. And there's a couple of correlates that I wanted to mention. So, for example, there's dream recall frequency. So the more dreams you recall when you wake up. So, for example, if you recall having dreamt, the more days you can do that, then the more likely you are to experience more frequent lucid dreams. And obviously, when someone can. It shouldn't come as a surprise, because the more dreams someone can successfully recall, then the more likely someone is to recall perhaps dreams that were lucid. But also, several studies have shown that there's differences between those who have high dream recall frequency versus those who have low, and these areas that are different between those who are high dream recall versus low are also implicated in lucid dreaming. Then we have age is a factor. The more we age, the less frequent lucid dreaming becomes. There's openness to experience, so which is a personality factor of the ocean, what's called the ocean model, which is the big 5 personality dimensions. And there's hypnotic suggestibility, creativity, and creativity kind of latches on to openness to experience. There's meditation, mindfulness, internal locus of control, need for cognition, and attentional ability. And what's basically all these studies show is that the more cognitive ability you have during wake, and metacognitive ability, also using mindfulness and meditation, shows that the more of cognitive metacognitive ability you have, then it's kind of transferable to dreaming. So if you're waking consciousness, then when you go back into, when you are dreaming, then these cognitive abilities are less likely to reduce, or they don't reduce so much. So you're more likely to experience lucid dreams. So I'm not going to go too much into this because I'm mindful of the time. A question is then, can we train lucid dreaming to be induced more often? And yes, the answer is yes. Lucid dreaming is thought to be a skill that can be trained to occur more frequently. So there are several lucid dream induction methods that have been developed to increase the frequency of lucid dreams with varying degrees of success. And these techniques are roughly, categorized as cognitive, external stimulation, and drug applications. So cognitive induction techniques are techniques that you do during wakefulness or while you're falling asleep. And there are things that you do, thought patterns that you do, and tasks that you engage in that basically help incubate a lucid dream to happen. And I will describe a few in the next slide for the external cognitive techniques, which everyone can do actually. And then we have external stimuli techniques, and these techniques, they use things such as audio, light flashes to the eyes, or tactile stimuli during REM sleep. And the aim of them is that to incorporate them into the dream scenario in order to alert the dreamer that they are dreaming. And then we have the drug application, which involve taking specific supplements or drugs, usually before sleep, which help shift brain activity towards the lucid dream state. And one of these drugs which show promise is the drug galantamine. It's an acetylcholine inhibitor drug that is typically used to treat mild or moderate Alzheimer's disease. And it's been shown to increase the likelihood that someone has a lucid dream when they take it just before bed. So I wanted to describe three cognitive techniques that people can try at home. They don't require any special equipment or taking any supplements or anything like that. And one is the reality check technique, which basically refers to asking oneself regularly throughout the day whether they are dreaming or not, and to examine and then subsequently examine the environment for possible incongruences. For example, in dreams, maybe we dream we're in our bedroom, for example, but if you notice, there's a thing with dreams that usually it's never 100% same representation. There's some differences, or maybe you're in a place that you shouldn't be. So this is what we mean by congruences. Or you're seeing something that shouldn't exist, for example, like a dragon. So when this happens, when you do this, you also do what is called a reality check, which is basically it's an action that leads to a different outcome when you do it when you're dreaming. And a common one is pinching your nose while trying to breathe through it, which is of course impossible. However, if you do this a couple of times during the day, then you have more chance of dreaming about doing this, reality check, trying to breathe through your nose while you're pinching it. But obviously, because you're dreaming about pinching your nose, you're not actually blocking, your nasal pathway. So you will, when you do this while you're dreaming, you feel the air going through your lungs, and that can be kind of like a light bulb moment to make you realize, wait a minute, this is a dream. And then there's this other technique called the wake back to bed method, where it's suggested to wake up 1 to 2 hours before natural waking time and to stay awake for a brief amount of time and then go back to sleep. And just this mere thing, this brief awakening during the middle of the night is suggested to, is shown to increase the likelihood of lucid dreaming because it's thought that this brief awakening causes an increase in cortical activation. So when you go back to sleep, your brain is more activated, and these frontal areas that we've talked about are more activated, so hence higher likelihood to have a lucid dream. And also a study has even shown that, you know, the lucid dream frequencies is positively correlated with the amount of times you press the snooze button, the alarm snooze button. And that's, you know, unintended, without intending it. If we use the snooze button and go back to sleep, that's a high time. That's one of the times that we can also, there's an increased chance of having a lucid dream during that time. And then we have the mnemonic-induced lucid dream technique. And short, you know, mild, basically, it's called mild. And it entails rehearsing a dream prior to falling asleep and then visualizing becoming lucid while focusing on the intention to remember that you're dreaming. And you do this by, so while you're falling asleep, you're visualizing becoming lucid. And then you also repeat this kind of mantra. Like next time I'm dreaming, I want to remember that I'm dreaming. So you repeat this and you will do this visualization exercise while you're falling asleep. And then this can increase the likelihood that you have a lucid dream. And studies have shown that, and a study I did in my thesis, that shows that combining all these three leads to a higher likelihood that you lucid dream than, you know, trying these techniques in isolation. So basically, you'll do reality checks during the day. You set your alarm 2 to 3 hours before your normal wake time. Then you do the mild technique while you fall asleep again. And this is a combination that anyone can try. So as I mentioned before, you know, there is with stimulation techniques, when they are presented during sleep, they have a tendency to become incorporated into the dream content. And this happens either directly or indirectly, meaning indirectly, meaning they incorporate in an altered form. So a direct way would be if someone flashed lights in your eyes while you're sleeping. You might see like a bright light everywhere, like in your whole field of view. That would be a more direct incorporation. However, you know, if you're dreaming, for example, that you're giving a lecture in a lecture theater, an indirect incorporation would perhaps, you know, make the lights of the room flicker on and off. So it would be an indirect incorporation of the stimulus. So an explanation for how the stimulus incorporation works is that the stimulation produces what's called a microarousal. So basically, there's a slight awakening of the dreamer, just enough so that they perceive the stimulus, but not enough to wake them up. So the dream then continues, but the mind has already registered a stimulus that doesn't quite fit with the dream. So in order to maintain the dream, then the stimulus becomes recontextualized and now becomes a part of the ongoing, basically, dream narrative. So this kind of process of integration, how it integrates, is also known as multisensory integration, and it refers to the mind's tendency, preference for a unified perception of the world. So when two stimuli of two different, for example, two different modalities, stimuli of two different modalities coincide, we tend to think that they're related. So, for example, when a sound appears at the same time as a visual stimulus, we tend to think that the image produced the sound. So, accordingly, when the lights are, you know, flashed on someone's eyes when they're dreaming, and if the dream environment is a room, they may see, you know, then they could recontextualize the room lights going on and on, turning off and on. So. So an issue with actually an issue with these external stimulation techniques is that they don't always incorporate into the we don't exactly know when how to make this stimuli incorporate, you know, 100% of the time, let's call it. Or and also sometimes when they incorporate, the dreaming mind has this capacity, this skill to make a nice confabulation as to why the stimulus appeared. So then the stimulus can become excused, for example, and then if the person sees the lights going on and off, they may be like, oh, it's just a light bulb and it's malfunctioning, not because, oh, this is my cue and this means I'm dreaming. So so one of the things that issues with stimuli is that, when they use them in studies, sometimes they lead to awakenings because they're too intense or too loud. For example, if it's an audio for someone, or sometimes they're too weak to become incorporated, and so they either wake up or they're not strong enough. And like I said before, stimuli, when they might not lead to lucid dreams, even when they become incorporated, because they're excused. And that's what I tried in my thesis to prevent. So we know that, to avoid all these issues and to enhance your stimulation incorporation rates, I developed this novel external stimulation framework and protocol, and I called it the individualized auditory stimulation technique. And basically the overall aim of this technique is to present the stimuli as loud as possible and as frequently as possible without causing any awakenings. However, as you may have guessed, people's awakening thresholds vary from one another. Some people wake up from the slightest sound, while others might not even wake up if an earthquake happened, which has happened recently. So, so in order to present the stimulus as loud as possible and as frequently as possible without causing awakenings, the framework that I developed basically has to, aim was the way it worked was that I wanted it to predict the stimulus properties, whether that's intensity, whether that's presentations rate, by taking in some key, what I thought were key behavioral metrics, such as, how long the person slept the night before. Obviously, if they hadn't slept if you only slept 1 or 2 hours, you're more likely to have a deeper sleep than the night to catch up on the sleep that you missed on the night before. But also importantly, some physiological data that have to be acquired before any stimulation. So in order to make this happen, I used predictive machine learning algorithms. So machine learning algorithms, as you may know, learn from past data in order to make accurate future predictions. So the purpose of the study that I did was to create this database for the machine learning algorithm to learn from. So for my thesis, I only tried to create a database for the algorithm to learn to predict the volume of the stimulus so that future studies can investigate adjusting the presentation rate of the stimulus to the individual with the intensity of the stimulus already predicted. So to build this database, I created a study whereby the volume of the auditory stimulus would increase by small increments whenever REM sleep was detected. I haven't said this before, but when we sleep, we go through different stages of sleep, and it's the last stage of sleep, and we cycle through them. There are 4, and we go usually 1, 2, 3, 4, and the 4th stage is REM sleep. So which is associated with dreaming. So whenever REM sleep was reached, then the stimulus would appear and it would increase gradually until it reached a person's auditory awakening threshold. And then, importantly, I also used an auditory stimulus which informed participants that they are dreaming. So it literally said you're dreaming. Instead of using beeps, which, when it comes to audio and flashes of lights that other studies have used. because it is semantically richer. So it's, and I did that in order to avoid confabulation that your mind makes, that the dreaming brain makes, as to the origin of the stimulus. And then I not only informed the participant that they're dreaming, but I also, before that, I called out, I used a basically was the whole audio was computerized voice, which then not only informed them that they're dreaming, but also before that, it called out their first name. And the reason why I used to call out participants' first name is that previous research, unrelated to lucid dreaming research, has shown that when you present someone's own name during sleep versus someone else's name, or a sound or a beep, for example, when you present someone's own name, then you activate these frontotemporal regions of the brain that we know are key for lucid dreaming. Plus, perhaps people know what's called the cocktail party effect, that, we tend to we have a strong orientation and attention to our own name when it's presented. Maybe if you're in a loud cocktail party and everyone's talking at the same time, but if you hear your name, you can easily pick it out from all the noise. Another novelty that I've done with the protocol is that I trained participants before sleeping, obviously, to respond to the auditory stimulus, to, for example, Achilleas, you're dreaming, this audio, by doing a reality check. And I did that in order to condition a reality check to further enhance the likelihood that I would condition a reality check response when they heard this while they were dreaming. So this is different from, I took inspiration from a study that was done in 2020. And however, in that study, they conditioned people to, during the training phase, to do a reality, not to do a reality check, but to visualize themselves becoming lucid, while I condition a motor action, basically, of pinching your nose and doing a reality check. Another thing I did was I used this small wearable. This is a tiny wearable, the size of a matchbox, and it goes on the forehead. It's called Hypnodyne Z-Max. It has two, and then these electrode patches click here. And it basically has two electroencephalogram sensors, frontal ones. It measures heart rate. It measures movement. It even has a light sensor and a sound sensor. And another cool thing that this can do is that it can present you with light. So here there's some LEDs that can flash directly to the eyes, because it's placed above the forehead. So these LEDs here can flash lights if you want. You can play audio, and it can even vibrate. So you can provide tactile stimulation if you wanted. However, I only used auditory stimulation. And basically, I had participants, the procedure of the experiment is that I had participants lie in bed with eyes closed, and then I captured some resting state EEG. And then we had the training phase where for 10 minutes, they heard their name and that they were told they were dreaming. And then every time they heard it, they had to do the reality check. And then I asked, and then they were, after the 10-minute training phase, they were allowed to go to sleep. And also I told them that if they become lucid at any point, to do this specific eye movement pattern to signal to me in real time that they became lucid. And then they went to sleep, and then whenever REM was detected, then the volume of the stimulus started at very low setting, barely perceptible, and then gradually every 30 seconds of REM sleep, it would increase by 5%. And obviously at one point, the volume of the stimulus increased to a level that woke people up. And then and then they had to complete the questionnaire, and then they went back to sleep. And then they did another training phase, and then we started, the stimulation was then calibrated 10% lower than the volume that woke them up. And we started again increasing up at a much smaller increment level than during the first phase. So as I'm conscious of the time, I think we're at 41. Basically, we found we collected the first 3 hours of recording prior to any stimulation. So stimulation happened after 3 hours. So we collected various EEG signal characteristics, and then we fed them to a machine learning algorithm. And this machine learning algorithm was based on genetic algorithms, which basically pits together different machine learning pipelines together and then finds the most optimum machine learning combination and pipeline to make the best prediction for future predictions. So we found basically what happened, the results were that 55% of the participants had a lucid dream, and about 40 something even did a signal verification with their eyes. So they signaled to me with their eyes. We found some differences between people with who were high, who would you consider like had a high awakening threshold versus those who had low. And importantly, the predictive algorithm was able to predict with 100% accuracy whether participants belonged to a low awakening threshold group or the high awakening threshold group. So, however, it has to be said that we were not able to include a control group due to COVID-19. And although it has to be said that we're more interested in building the machine learning algorithm than proving seeing how strong what the ability was to use lucid dreams. And when it comes to machine learning algorithm, we took it has to be noted that there were 20 participants. So maybe the fact that it was 100% accurate at predicting whether you belonged in a low awakening threshold group or a high awakening threshold group could be an artifact of what's called overfitting, and that maybe if you got more data, it wouldn't be able to predict different types of cases, different types of people. But it has to be said again that we did everything to minimize overfitting. So we applied what's called leave one out cross validation. And we reduced the amount of behavioral and EEG features to less than 8, which are things you do in order to prevent the likelihood of overfitting the data. For future directions of the technique, there are in total in my thesis I outlined 12, but I'm only going to talk about 5 here, and and one is to use more EEG sensors, study this technique with more sensors that you typically use in EEG studies, not with a wearable, and to increase the training time, and to make some adjustment at which time points the algorithm takes data from in order to make predictions. And then future directions would be not only to adjust the volume of the stimulus to the individual, but also the presentation rate, and then also to have a control group in order to account for placebo effect, explaining at least in part some of the findings, the 55% accuracy, 50% induction rate. So just to finish off, why study lucid dreams? Okay, they're fun, and being the ability to do whatever you want in your dreams can be enticing to many, but it's been demonstrated to have a lot of applications, whether that is understanding cognition, whether that is understanding how consciousness is formed. Also used as a learning enhancement. It's been shown that if you practice a motor skill, such as throwing darts while you're lucid dreaming, actually leads to an improvement in performance, and that's because when we're dreaming about doing a specific action, we're actually activating pretty much the similar brain structures as if you're actually doing them. And what's called imagine rehearsal is a sports technique. So Formula One drivers, for example, they visualize in their mind's eye going through the whole track, and this has been shown to improve performance. Even visualizing in your mind's eye while you're awake that you're doing exercise, you can even lose a few calories, it's been demonstrated. So what more powerful sensory imitation than not just doing it in your mind's eye, but also doing it while you're dreaming. So it could improve motor skills. And one of the most promising areas is for therapy, so for PTSD, so PTSD for post-traumatic stress disorder. So people have PTSD, so war victims, and anyone basically who experienced a traumatic event, what they can have what's called post-traumatic stress disorder. And one of the things that this PTSD does is that it gives you recurrent nightmares, usually about the traumatic event that you experience. And it's been shown that if you train someone who has PTSD to have lucid dreams, then it can reduce the amount of nightmares or even treat them completely, which then leads to an increase in quality of life, reduction in insomnia, and many other metrics, and depression and all the things that come with PTSD diagnosis. So thank you for your attention. I think I went a bit over time, but hope you found it interesting. Thank you.